something to eat. I know, hungry. Okay, for me it's a pleasure to be here today and to represent the company CSN, which I've been here for the last 11 years. And I'm so happy to see all of you here. Thank you, thank you, thank you, thank you. So we're going to start with the president of the company, Mrs. Abate.
Thank you.
You're welcome.
So you said I have to be short? How can I be short? So, but I will try to be brief for people who know I'm very rarely brief, but I will make the attempt. When you want me to stop speaking, you go like this. So we're so delighted to have so many honored guests here, our patients who are our most honored guests, members from the community, and people I've just met, who I know we're going to be great friends, is Eduardo Logrer, who is the Chief Executive Officer of the Neighborhood Association for Intercultural Affairs, and Ralph Salamanca, who is a center director for us, who is the Chair of Community Board 2? District Manager. That's even a more important position, unless the chair is here. And Raquel Ibrahimi from the Family Justice Center, and Maya Sher, thank you for coming from the Violence Intervention Program. I worked with your program many, many years ago, when you were probably in 5th grade. And we're expecting the City Council representatives from the Bronx Borough President, representatives from the City Council, the Assemblyman himself. But let me just start and thank Crespo, thank you. Yes. I'm Catherine Abate. How are you? So why don't you pull up a chair?
Yeah, I'm fine. I'm trying to grow, so I'm all right.
You're trying to grow too? Okay, I've grown enough. So I want to first recognize the staff of Community Healthcare Network. Miriam, of course, and Mabel, our wonderful new center director, who I think is going to provide great leadership to this program. So many of the staff that are here, our senior management, Dorothy Farley, Martha Fabrice, Freddie Milano, Elizabeth Howe, I could go on and on. Our wonderful center directors, if I name 2 and I don't name all, but you know who you are. Great leadership, and the staff of the Bronx Center, and thank you for making this possible today. This is very important. We should have domestic violence awareness day and month, every day of the year. Because too many people suffer in their homes, on the street, in their neighborhoods, and feel that they're alone. But unfortunately, far, far too many people suffer from domestic violence. And it's not just women, although primarily it's women. It's also some young male adolescents, some young men. None of us are immune, not by race, by ethnic, by age. All of us could be at any time a survivor. And I say survivor because most people who have been victimized hopefully overcome it and become stronger with our help. Let me just start with, I spent years in the criminal justice system. And I always thought domestic violence was a criminal justice issue. I was chair of the State Crime Victims Board, probation commissioner for New York City, correction commissioner for New York City. When I was in the state senate, I was the ranking Democrat for crime victims, crime and correction. So I started out as a legal aid society attorney in criminal court. So I spent over 20-some years in the criminal justice system seeing the faces of these crimes, the devastation not only to the women, but their families and their children, the impact it had on neighborhoods. So I used to think, what are we doing in the criminal justice system? So much pain, so much suffering. It all happened after an arrest. Can't we do better as a society to prevent and assess it? I'm in a community healthcare network now for 10 years. And I now know it's not just a criminal justice problem, it is a public health problem. And sometimes the first person, that individual who is being victimized sees, is maybe the person at our front desk. And they give information to the front desk and say, I'm having a bad day. Or going to tell you a little about it. So information sometimes is relayed firsthand to us at an early stage before even the criminal justice system gets wind of what's happening. So our job is a very important job. At Community Healthcare Network, we provide primary care. So we have providers on site, but just as importantly, we have social workers who are trained to work with survivors of the crimes to make sure they get the help. We have mental health services. We have health educators, nurses who are trained to assess. So part of our job, and no one should feel that there's any stigma, because any one of us in our lives could be in this situation. And when you calculate the numbers of people who have been victimized in this country or around the world, the numbers are in the millions. It's astounding. So our job in healthcare, and we take it very seriously, the most important person to us is our patient. If it's not, we're doing something wrong, and we'll try harder to do better. And to make sure if you have the situation, you get the resources, the information you need to keep yourself and your family safe. So we're here for you. Our job is to serve not only our patients, but the community at large. And we've been around since 1981, and we want to continue this work. No one gets turned away. We don't care who you are, what poverty level you're at, if you make money, if you don't make money, whoever you are, you should be treated the same, and there's a place for you at Community Healthcare Network. So I want to thank you all for coming. We're proud of what we do here, and we love the partners that we're developing in the community and the new partners that we're going to develop over time. So thank you for coming, and I hope I kept within my time limit.